All right, well, for the sake of time, we're going to go ahead and get started. So again, thank you guys for joining us this morning. We're really thrilled to have you partake in a series. So with the COVID-19 pandemic upon us, the faculty of the Columbia University School of Social Work have mobilized the forum COVID-19 Action with the mission of monitoring developments and disseminating information that can be useful to social workers and the clients that we serve. So this particular webinar is part of the Social Policies and Service series with the focus on COVID-19 related strategies for supporting efforts at the local state, at the local, state, and federal levels. All right, so today with us, we're going to have Matt Murray and Jane Walfogel joining us. Before I turn it on over to them, I first just want to go over a couple of housekeeping. I'll let you guys know that everybody's mics and videos are turned off as this is a webinar. But with that, we really love to see you guys and encourage you guys to be utilizing a chat box. These webinars have also been just a really great opportunity for people all over to come together as colleagues in a community. If there's something that one of the presenters are saying that resonates with you or that you want to add commentary to it, definitely share that with everybody in a chat box. If a peer of yours shares something, please go ahead and respond back to them in a chat box. It's just been really great to see, again, the conversation and connections and networking that has developed through the chat box. Now, in order to best utilize that, there is the default option, I think, for most people is that your comments are going to go to just the panelists. So when you're typing in a chat box, just above where you type your message, there's a to box. Click on that to select all panelists and attendees. So that way your colleagues can go ahead and see your messages as well. If there's something that you want to type to just the panelists only, then definitely for sure keep it or just change it to all panelists. If you're having some tech problems, we do have tech support on the line to assist you if needed. We'll also be utilizing the Q&A box. That's where we're going to be asking that you type questions. There's a lot of today's presentation is going to be spent answering questions that you guys have about the content, just to make sure that we can track those and get as many of these questions answered as possible. We're asking that instead of putting the questions in the chat box that you put them in the Q&A box. And with that, again, we're really excited to have you guys here. Within 2 to 4 business days, you guys will be receiving emails that contains the evaluation links for CE. All right, I'm going to go ahead and turn it over to Matt and Jane, and thank you guys again for being here today.
Hi, everyone. So thanks for joining. We're excited to share about the state of paid sick leave in New York City. I'm going to start off by going through some analysis we've done, and then Jane's going to talk about some analysis we've done about paid sick leave in New York City, and then Jane is going to talk more broadly about paid sick leave nationally. So my name is Matt Moore. I'm a research analyst at the Center on Poverty and Social Policy, where I work on a project called the Poverty Tracker. The Poverty Tracker is funded by the Robin Hood Foundation and supported by the Center on Poverty and Social Policy and by Columbia's Population Research Center. Recently, along with my colleagues Chris Weimer, Sophie Collier, and Jane Waldfogel, we released a brief detailing paid sick leave in New York City. In this brief, we examine laws on the books and rates of payment for sick leave prior to the crisis. Additionally, we examine recent state and federal legislation and how they are impacting the landscape of paid sick leave in the city and the state. And I just want to say up front, the laws are changing kind of quickly. So if you're, consulting with someone about what they might have access to, we're going to share a bunch of links at the end that I would, ask you to go there to confirm that the laws haven't changed and that you know exactly what you have access to, and just don't take it from this presentation. As I said, things are changing quickly. So in the following slides, I'll start by going over the laws on the books at the federal and state and city levels. Next, we'll look at the rates of being paid for sick leave using Poverty Tracker data from 2018. And finally, we'll look at the recent expansions in paid sick leave at the state and federal levels. Here we'll detail what increased coverage the laws provide, who is covered, who is left out, in addition to sharing a number of links that should be helpful for employees who are trying to figure out what sick leave they're guaranteed. So we'll start at the federal level, where there is no law mandating paid sick leave. The Center for Economic and Policy Research found that out of 22 countries ranked highly in terms of economic and human development, the US was the only that did not guarantee workers any paid sick leave. Despite this, many workers in the US have access to paid sick leave through their employers, though there are major inequalities in who's receiving paid sick leave. Disparities exist between those working full-time and part-time and by income level. Additionally, a study out of Seattle found that while most employers offer paid sick leave, there were inequalities within firms with respect to who received paid sick leave. Next, we'll discuss New York State, which, like the federal government, did not have a law mandating paid sick leave does not have a law mandating paid sick leave. In 2018, New York State did pass the New York State Paid Family Leave Act, which provides employees with up to 60% of their regular pay for 10 weeks to care for a new child or a loved one suffering from a serious illness. Since 2014, New York City has had its own paid safe and sick leave law. This law provides employees with up to 40 hours or about 5 days of paid sick leave. Employees accrue 1 hour of paid sick leave for every 30 hours worked. The law covers those working for employers with 5 or more employees and those who work for smaller employers who work off the books as independent contractors or as federal work-study employees are not covered. So here we use data from the poverty tracker to analyze the rate of payment for sick leave in New York City. We see that despite the 2014 New York City legislation, 30% of New Yorkers are still not being paid for the sick leave they use. When we look at those below the poverty line and those who experience a material hardship, we see increased likelihoods of not being paid. 60% for those in poverty and about 40% for those experiencing material hardship. And here I just described how we define a material hardship using the poverty tracker data. A respondent is said to be in hardship if they have trouble paying for expenses in one of the following 5 domains. So that's food, housing, utilities, medical, or general financial difficulties, which is often running out of money in between paychecks. So the importance of paid sick leave is clear. It allows workers to stay home without having to decide between losing pay or going to work while sick. For a higher income person without access to paid sick leave, they may be able to weather the storm with funds they have on hand, but for lower income people, having such funds is less likely. On this slide, we look at the rates of a few vulnerabilities among those lacking access to paid sick leave. On the left, we see among those without access, 37% are in poverty. Next, we see 44% are facing material hardship. And finally, on the right, we see 55% say they wouldn't be able to access $400 in the case of an emergency. These figures illustrate that among those not receiving paid sick leave, there are already serious vulnerabilities. And without access to paid leave, many will be forced to go into work while sick or risk falling even further behind. In response to the epidemic, the federal government has passed a number of pieces of legislation. One of those is the Federal Emergency Paid Sick Leave Act, which provides paid sick leave to those working for firms with fewer than 500 employees or more than 50 employees. While those with under 50 employees are technically covered, this requirement can be waived by the federal government on a case-by-case basis, meaning it's not actually guaranteed. The law mandates that those who are quarantined or have been advised by a healthcare provider to self-quarantine or are experiencing symptoms of COVID-19 and are seeking a medical diagnosis are entitled to up to 10 days or 80 hours of paid sick leave. For those caring for a sick family member or a child whose school or daycare has closed, they can receive 2/3 of pay for up to 12 weeks under the Emergency Family and Medical Leave Expansion Act. After employees have utilized, additionally, the state has recently expanded paid sick leave for quarantined workers. They mandate 14 days of paid sick leave for those working for employers with 100 or more employees, 5 days for those working for businesses with 11 to 99 employees, and the law doesn't guarantee any additional paid sick leave to those with 10 employees or less, unless that company has a net annual income of more than $1 million, in which they would receive the same 5 days that companies with 11 to 99 employees receive. After employees have utilized their paid sick leave under the state law, they can apply for paid family leave and disability benefits for up to 100% of their pay. The law also expands coverage of paid leave for employees who have a child who is under quarantine. Recently, the state has also passed its own new paid sick leave law, and this is different than the emergency paid sick leave policy. This law is quite similar to the city law. It states that those working for employers with 5 or more employees are eligible to receive 40 to 56 hours of paid sick leave per year. And it does not preempt or diminish existing city or county level sick leave laws, meaning days cannot be stacked and be stacked with those guaranteed under the city law. So this kind of provides additional paid sick leave to the state. Doesn't really change much in the city in terms of paid sick leave. Turning back to the emergency legislation, I just want to talk about how the laws interact. So not included the recent permanent paid sick leave expansion, which doesn't go into effect until September. We see that the state's emergency paid sick leave law cannot be stacked with the federal law, meaning you can't take the 10 days you get from the federal expansion and the 14 days from the state expansion and combine them for 24 days. On the other hand, you can take you can use the federal or state laws in conjunction with the city law. So if you have 3 days of paid sick leave under the city law, you won't lose that by using the state paid sick leave you're allotted. And thinking about who is left out, those working for smaller employers are left with less guaranteed paid sick time than those working for larger employers. Those caring for children or family members are left with just 60 to 67% of their pay, which for many families won't be enough to stay above water, as they're already having trouble meeting a lot of their expenses. And then finally, those who are sick for longer than the time they might be receiving, right? So you can be, COVID could last for longer than 20 days. So if you're sick for longer than that period of time, you might not be fully covered. It might have to make a decision about going back to work while sick. At this point, I'm going to turn it over to Jane to discuss some links we're sharing in paid sick leave more generally on a national level.
Great, thanks, Matt. So Matt's focused on New York City, New York State, and the federal provisions, which, as you can see, are quite complicated. We did also want to talk briefly about what's the case outside of New York City and New York State, because we know that some of you are in other jurisdictions. There's actually a number of states and cities and counties that have their own paid sick leave laws, similar to what New York City did. And you can find a listing of those at this website, the National Partnership for Women and Families, and they are constantly updating their links. So as Matt emphasized at the start, if you want to know what's the state of the world in Connecticut or in San Francisco, just to mention a couple of places that have their own paid sick leave laws, please refer to the National Partnership for Women and Families. As of today, there are 8 states plus the District of Columbia. There are 18 cities and counties that have their own paid sick leave laws, but that's as of today, May 8th, and there may be new ones passed in future. Similarly, the National Partnership for Women and Families has for a long time tracked paid family leave laws. Family leave laws are important because sick leave usually covers a short period of illness, and usually for yourself or sometimes for dependents. But the kind of laws that we've been talking about often cover, say, a week or 2 of sick leave. Paid family leave, in contrast, often can go up to something like 12 weeks, and is when you need leave to care for a sick child or a sick family member. Interestingly, under the newest federal law, this is the first time there's paid family leave at the national level. This is also available if your child is out of school and you have to be at home caring for your child. So it's not even that the child is sick, it's that the child is home from daycare or school, which of course many children are nationally. But there's also paid family leave laws at the state level. As of today, 5 states have laws in effect. It's California, Rhode Island, New Jersey, New York, Massachusetts. 3 more in the District of Columbia have laws they've already enacted that come into effect later. But again, these things change rapidly. Matt, if you can go to the last slide, we just on this last slide have some other links about the laws that Matt talked about already. New York City's paid sick leave law, New York State's paid family leave law, which is quite a generous one, New York State's paid sick and family leave expansion, and then the US paid sick and family leave law. I think it's really important for any social worker, regardless of the state that you're working in, to be familiar with the US paid sick and family leave expansion. This is the expansion that provides 2 weeks of leave if you're sick yourself or your child is sick, and then up to 10 more weeks if your child is sick, your partner's sick, somebody else you're caring for is sick, or if your child is home from school or daycare and you have to take care of them. There's a piece in the New York Times today by Claire Kane Miller who really specializes in paid leave. And what she found was that up to half of employees nationally are not familiar with this expansion and do not know that they're allowed to take paid leave, not only if they're sick or a family member is sick, but also if a child is home from school or daycare and they need to be providing care for the child. So it's really important to be aware of that, because people who are lucky enough to still have a job may still need to take some paid leave. And there are a lot of people who are employed but reducing their hours at work because they have to juggle work and childcare or care for a school-aged child. Before reducing their hours, employees could take paid leave and they'd be on the books getting paid. So it's really important to know about. And then finally, to make things even more complicated, we wanted to mention that there are a number of states and cities that have enacted COVID-specific laws or issued COVID-specific guidance that makes their existing laws more generous or expands existing laws to cover COVID situations. And again, that terrain is changing rapidly. The best source that we found on that was an article in the National Law Review, so we've provided a link for that. So I guess our bottom line message is, refer to these slides. We hope you'll find them helpful, especially those of you who are in New York. But if you have a client that you're advising about a situation where they may need to take leave, they're thinking about reducing their hours, even quitting their job because somebody's ill or because somebody is home from school or daycare, go to one of these links and find out what they might be entitled to, because there's a lot more leave available with pay than ever before in the United States. This is just a remarkable moment. And unfortunately, because it's changing so rapidly, people really don't know about it. Honestly, I mean, I've been working on paid leave for 25 years, and I am having trouble keeping up with all the changes in the legislation. So it's our job as social workers to be on top of this and make sure that we let clients know about it, because as I said, for those who are lucky enough to still have a job, these benefits are really important. So with that, we'll go to question and answers, and we're happy to take your questions.
All right, so we do have some questions in a Q&A box but we definitely welcome more. Please, this is a great time for you guys to go ahead and just go ahead and add to those questions. I will also speak to, just so you guys know, we will have the slides available to everybody. They will be posted on the COVID-19 Action website, so you can find copies of all of our slides after, like within a day or two after each webinar. All right, so the first question that was asked is, what action can an employee take if they are not being offered paid sick leave as their employer is required to do, specifically if they fear retaliation or do not have an HR department?
That's a really good question. I mean, the Department of Labor makes it their business to post both fact sheets for employers and fact sheets for employees. So one good resource would be the Department of Labor has these worksheets, these guides for employers and employees. So passing along to the employer in a non-confrontational manner, Department of Labor fact sheet that explains to employers what they're supposed to be providing might help provide a sort of subtle message that the employer actually is violating federal laws in terms of what they're supposed to be providing. There's also advocacy organizations out there that can be of help. A Better Balance really specializes in issues around work and family conflicts. And I believe they're not just a New York organization. I believe they would help out nationally. So I would try A Better Balance. Legal aid within New York, I would try legal aid, or try, if you're outside New York, looking at the equivalent of legal aid. Those would be some suggestions.
Additionally, I think I feel like I saw something on one of the fact sheet websites about reporting employers who weren't providing paid sick leave. I can't remember if it was at the state or the city.
Usually states and cities have wage and hour divisions where you can report, you know, infractions, you can report employers. So yeah, there's a number of different approaches to
Yeah,
take.
so I would look there too to see if they might have a link of somewhere where you could report if you think it's a violation.
All right, thank you. And then we also have another attendee asking, can paid sick leave include time caring for a parent in a nursing home?
So the paid sick leave, the emergency acts would not include time caring for a parent in a nursing home. I think that could be covered under the paid family leave,
Yep.
depending on you know, what was needed to take care of that person in the nursing home.
Yeah, the paid family leave laws vary quite a bit in terms of which types of family member are covered. And the National Partnership for Women and Families, their listing shows by state which kinds of family members are covered. But always these laws cover a parent, a child, and a spouse or partner. So they always cover parent, child, spouse, or partner. So yeah, if it's your parent that you need to care for and your parent is seriously ill, then anything that's labeled, you know, family leave or paid family leave, you're entitled to take. If it's your grandparent, if it's your parent-in-law, then it depends on the state. And so you need to then look at the state statute.
And the federal and state paid family leave policies are for 60 to 67% of your income. So it's not the same as paid sick leave where it's the full 100% of your income.
All right, and then we also have a couple questions asking if you can please again review about stacking sick leave. So like, do you have to use one of them first or instead of the other? How do these laws combine for people who are in New York City?
Yeah, so Jane had called this out as being the first question. So good job, Jane. But yeah, so it's quite complicated. So there's the two emergency paid sick leave acts, the federal and the state. Those cannot be stacked with each other. So you can't take, you know, the 10 days you might receive from the federal and the 14 days you might receive from the state and combine them. You'd have to use one or the other. So I think that would depend on whatever your situation is. Whatever you can get, whatever would give you the most days would be the best idea. And then there's also the city paid sick leave law that's been on the books since 2014. And that can be combined with those laws. So it'll depend on how many days you have accrued at this point in time. But you can use, you know, if you have 3 days under that law, you could still use the 10 days under the state law or the federal law. And I don't think that the order is important.
So you would sit down with your human resources manager or your supervisor and you'd go through, there's actually mandatory reporting in New York City for employees. People have to keep timesheets and show how much New York City paid sick leave they have. So, because I know I sign off on these timesheets. And figuring out how much you have under New York City and then how much you would be eligible for under either New York State or the federal law, whatever the maximum would be, and then using that. And then, you know, turning to paid family leave if that's relevant. I guess going back to the question about what do you do if your employer is not complying with these things, part of the federal law, part of the federal law that is also not well understood is that when employers provide paid family leave, they can actually get reimbursed for that by the federal government. And that was why the law excluded large employers, because the federal government thought large employers don't need to be reimbursed. They should be providing this already. And if they're not already providing paid leave, if they start providing it, they can cover it, they can afford it. But they were trying to make it affordable for employers. So for an employer who's balking at providing it because it would be too costly to pay someone while they're out sick and they have to hire a replacement worker maybe to keep the business going, it's worth knowing that the employer actually can file and get reimbursed for that.
All right, thank you. And then we have an attendee asking, concretely, how do you figure out how to apply for any of these benefits? So it's kind of going to tail off a little bit, I think, around the stacking, but kind of just starting to figure out like the process of taking those steps to apply.
Yeah, I think what you would do is you would, so like Jane mentioned, the city paid sick leave law, you in your timesheet, you should be able to mark down this paid sick leave is under the New York City law. For the state and federal government, I think what you need to do is submit some documentation of your situation. So that might be something from a doctor to show your being quarantined, or something documenting that you have to stay home with your children because schools are closed. And I would point you to the websites, the fact sheets, to see exactly what materials you need and where you should submit them.
But the payment's always coming from the employer. Is that correct, Matt?
Right. Yeah.
Your payment's coming from the employer. It's not like unemployment benefits where you go online and you're applying to the Department of Labor or wherever, and you then get a check from unemployment. It's not like that. These are benefits that your employer is paying you because you're still on the job, and it's just paid time off. So it's just like if you're applying for vacation time or personal time, your employer is paying it, and then behind the scenes, your employer is filing with the state or the federal government to get reimbursed through various funds. But that's for the employer to manage.
Okay. And then are any of these paid leaves retroactive?
I'm not sure about that. I didn't see anything indicating that. And to me, that would seem, I'm not sure exactly what that would look like. So I don't know if Jane has any information about.
No, that's a really good question. So for somebody who's already taken some time off the books, said to their employer, I'm going to have to take, I just have to take, reduce my hours or take some time off because my husband and I or my partner and I are juggling childcare, and now discovers they could have taken paid leave. Yeah, I think that's a conversation to have with an employer, or maybe to check one of these organizations that provides these fact sheets to find out whether there's any whether you can file retroactively.
Okay, thank you.
I know that, often sick leave or family leave or disability leave, there's waiting periods. And I think some of the COVID-specific guidance and COVID-specific laws have shortened waiting periods so that, you don't have to be out sick for a while before you can start claiming these types of leave. But I'm not familiar with anything that's retroactive.
All right, and then just follow up. This is from the same person who was also asking about the stacking and how concretely going about applying for them. He says, so as an advocacy perspective, it seems that you should start with New York City paid leave first and then stack the most amount of state or federal leaves, correct?
Yes, yes. And I think picking up on the question about retroactivity from an advocacy perspective, the time to get the word out to everyone is now, not when somebody needs the leave, because by then they may not have known about it and may have already done something like taken unpaid leave or quit their job or reduce their hours because they weren't aware of it. So it's really important to get this information out proactively in advance.
All right, we have another question. Nurses are forced to go into work even when they are ill. How legal is this, and what can they do?
That's a good question, and I'm not really sure. I would think nurses would be likely to be represented by unions or to have a fair amount of bargaining power. But I do understand the pressure to come in when hospitals are short-staffed. So that's tough because then it's not so much a question of having paid leave, but yeah, I've got paid leave, but I'm being pressured to come in. And that's an issue for all of us. Yeah, and I'm not really sure who in New York City would address that. The Department of Health would be maybe the most likely to address that, but again, maybe checking with legal aid or checking with the union if it's a situation where there's a workplace union. Because the intent of the law in New York City and the intent of these other laws is that people won't work when they're sick because of public health concerns.
And then can an employer require that an employee exhaust all of their PTO, such as vacation time, before allowing the use of paid sick leave?
No, they're not supposed to, no. Employees may use their paid time off if they prefer, but they're not supposed to be required to, no. And from an employer's perspective, it actually would be less advantageous to do that because their paid time off and their vacation time is 100% employer paid and 100% salary. Whereas these paid sick leaves, especially when they get lengthy and they turn into paid family leave, are not at 100% pay, and they're reimbursable by the federal government. So it's not even in the employer's interest to make an employee use their paid time off first. But from an employee's perspective, if they feel, confident that they're not going to need the paid time off for other reasons, this may be a year they're not going to take a vacation because none of us can travel, and people don't have a lot of discretionary income, it might be a smart move to use some vacation time first, because as Matt was pointing out, quite a bit of the extended time off under these new provisions is not at 100% pay. It would be at 60% or 2/3 pay.
All right, so our CSSW COVID-19 Action Initiative is working to connect volunteers with agencies who collaborate with us through the Fieldwork Department. If either consumers or agency staff have questions related to paid sick leave, is there someone at the center to whom we might refer them to have their questions answered?
Yeah, you can refer them to me. Tiffany, I don't know the best way to share my email. I can just type it in down below in the chat unless you think there's a better way to share it.
Or maybe you can add it to the slides when they get posted, Matt.
All right, yeah, we haven't uploaded those yet. So yeah, I'll add it to the first slide so people can access my email there.
I think that would be great. Thank you.
Mm-hmm.
All right, and then we also have another question coming in. I believe that the federal law says that if an employer is offering telework, that the employee cannot ask for federal leave, even if they have children at home to care for. Are you guys able to confirm that?
Yeah, so if they can work at home, they would not be covered. I think it's unclear if the person, if they were too sick to work, I think that they would have a reasonable claim to paid sick leave. Even if they were allowed to telework, but they were, bedridden or on a ventilator or something like that. With children at home, I think they would still be asked to work.
Okay. And then how should someone document COVID sick leave if there's a lack of testing, especially if people are being encouraged to stay home and not seek medical care unless they are extremely sick?
Yeah.
Yeah.
No, yeah. So some of the laws, right? The federal law says if you are quarantined, if you are currently seeking a medical diagnosis, right? So in that case, if you could document that you're seeking a medical diagnosis, that might be enough while you wait to hear from a medical professional. But yeah, it is. I think it depends on the specific law, what they're asking for. But I would just say gather as much information as you can about your actions to seek quarantine or figure out if you have the virus or someone in your family has the virus.
Because quite a few of the laws refer to if you have COVID-like symptoms, you're experiencing COVID symptoms. So as Matt said, you can, document that you have symptoms and that you've been in communication with your medical provider, and your medical provider's probably said something like, yeah, you probably have it, but I wouldn't, you don't need to get tested, or I would stay home, don't go to an emergency room, stay home, don't go to work. That would be sufficient.
Right.
Yes, are experiencing symptoms of COVID. It doesn't, or seeking a medical diagnosis. You don't have to have been tested.
Right.
Okay, thank you. And then what might be some stipulations a person would not be granted family leave due to current childcare issues?
That's not clear to me. So the city and state, the federal and state laws say if a school has been or daycare has been closed. So I think that's happening pretty frequently across the board. So beyond that, like if those two things haven't happened, I don't know what the rest of the criteria would be for taking care of a child.
Yeah, I mean, normally under family leave, it would be that the child is seriously ill, or you're arranging care for a newborn or newly adopted foster child or adopted child. The COVID provisions expand that to a child whose school or daycare has closed. That's what the current federal law is. Now, as we mentioned earlier, a lot of the states and cities are altering their laws and adding COVID-specific guidance. So that would be something to keep an eye on, because right now it's if a child whose school or daycare has closed. That may change in the future and become more generous.
Right, and I think
and actually the summer will be interesting because by definition, schools are closed all summer. So we're coming into a season where a lot of people are going to have trouble working because they have no care for their children over the summer.
Right, yeah, and the laws do specifically say, like, if you have, if your normal daycare has been closed, right? So even if you have a babysitter that is no longer, leaving the house, they're social distancing, they're not coming out, so you don't have access to that. I think that should be covered as well.
Oh yeah, yeah.
All right, and then when someone, what if someone cannot go to work because they are deemed high risk, or they have a child who is high risk? And can they take any paid leave?
Unfortunately, I don't think they're covered by these laws. These are all specifically about actually dealing with COVID in one way or another. I think it would be great if these people were covered, because to ask someone, an older person or someone with pre-existing conditions, to go back to work when this is all still going on seems dangerous. But under these laws, yeah, they're not covered by any paid sick leave.
Yeah, because the law we're looking at, the federal law, refers to self-quarantining, and I think quarantining refers to when you feel like you think you've been exposed and you've been quarantined, and that's different from being isolating because you feel like you're at high risk and you're trying to avoid exposure. So the way the federal law is written, but again, this is the current federal law, so this could change in future. So it is always worth keeping an eye on new developments. It looked like there was also a question about, well, a similar kind of question of what if maybe the daycare has reopened, but you're not comfortable sending your child because you're worried about infection. You may have a vulnerable high-risk family member. The child may be high risk. And unfortunately, it looks like that at this point is not covered. But always check for updated provisions.
Yeah, and similarly, I think the federal government recently said that you can't receive unemployment because you feel unsafe going back to work. And I think that I read that they're setting up a website for employers to report people who've been invited back to work but don't feel safe. So yeah, I don't think much of this covers those who just feel generally unsafe about going back into the world, which is totally reasonable, I think.
Right. And then another question is, can you apply for a consumer directed personal assistance program to supplement income when caring for a sick parent?
I have to say I'm not familiar with that program. I'm sorry.
Yeah, I'm not familiar either.
I have to say we split up all the different policy topics among the faculty and researchers at the school, and we have a whole series of events. One just on unemployment insurance, I think, one on food stamps and food assistance, one on stimulus checks. So we've kind of split things up. One on immigrant access to benefits and how, to what extent immigrants are included or not included in all the different provisions. So that the provision you just asked about hopefully will be covered in a different session, but we were just going to focus on paid leave.
Okay. And then we have another question asking, can you talk a bit more about employees that want a reasonable accommodation, such as working remotely? So maybe not necessarily leave, but in lieu of leave, being able to work remotely.
Yeah, that's a really muddy area, and it's so dependent on employers. And I think we're going to be in uncharted territory because now so many people have worked from home in jobs that we never imagined could be done from home. So I think employees are going to be on much firmer ground. But push comes to shove, it's going to come down to the relationship between the employee and the employer, and you know, some of the groups that we mentioned earlier, whether, you know, sort of legal advocacy groups, unions, Better Balance, maybe groups that, you know, can be helpful in negotiating this, but it's going to come down to reaching an agreement with an individual employer.
Mm-hmm. All right, and then this is also just got touched on a little bit, but kind of going specifically further. If someone is fearful to go to work and they have been diagnosed with an anxiety disorder, would they qualify for some type of leave? So beyond, you know, like many people are nervous, but then extending it to a specific diagnosis.
Right. So they could use their paid leave from the city, what's already on the books, but they would not get any of this emergency paid leave, which is just for those being quarantined or dealing with school shutdowns and changes in childcare.
And then can family leave or paid leave be used at all for a family death?
That's a really good question. I'm not sure that paid family leave can be used for death. There's a separate type of leave which is called bereavement leave. And again, some employers have bereavement leave. Some you have to use your personal time or your vacation time. So that's employer specific. I'm not aware of any laws that cover bereavement leave.
Yeah, I haven't seen any either.
Walking back to the question about personal time and vacation time, would a union contract terms exempt employers from honoring and require an employee to use that personal time?
If a union contract says employees must use personal time before using sick time, or you know, if there's language like that in a contract, yeah, then I think an employer is in a pretty good position to say, you guys agreed to this and this is the way things operate. I'm not sure there's many contracts that would say that you have to use your paid time off before you use family leave or sick leave, but I'm not sure why a union would agree to that. But if there is a contract in effect, yeah, unless that can be renegotiated, I think that would still stand.
Okay. Yeah. All right, and then there was some interesting data that was presented on that came from I believe the poverty tracker. Can you guys say more about what that is and how this information was gathered?
Yeah, so the poverty tracker is a study that's been going on since 2012. We do quarterly interviews and annual interviews as well. And in the quarterly interviews, we ask a lot about a bunch of different specific topics. And then the annual interviews, we ask about the different hardship measures and poverty measures, which we use to get this data. And so the poverty tracker, we do a lot of different research with it focusing on hardship and poverty, but it's been really useful in looking at changes in laws in the city because it's representative of New York City. So we've had the ability to add questions about paid sick leave before and after the law to see kind of what changes in the rates of being paid for sick leave have taken place. And we recently asked those questions again in 2018. So we looked at the questions there. But if you guys want to, if anyone's interested in looking at that more about the study or playing with the data, it can be found on the CPSP website, which we'll be sure to share in our slides too.
And as Matt mentioned, it's funded by the Robin Hood Foundation, which is a major anti-poverty organization in New York City. I think they spend $100 million a year fighting poverty in New York City. And in partnership with them, we administer this survey so that they can keep an eye on the pulse of New York in terms of poverty, hardship, and well-being. And in normal times, the study is headquartered on the 7th floor of the school, and the surveys are conducted by a large survey staff, including a lot of Columbia students who help out with the survey and work with us and have this as a part-time job while they're in school. So it's a fabulous resource, and because we run it ourselves, we can be super nimble in terms of adding questions. So when paid sick leave passed in New York City, we were able to add these questions about paid sick leave and have up-to-date data. We've been gathering data about COVID and COVID impacts. And I think, was it last Friday, we administered kind of a spot survey that 1,200 of our sample members responded to about what the greatest needs are for services in New York City and what they saw as the biggest challenges facing COVID. And that was, just really illuminating in terms of understanding what people are experiencing and also helping Robin Hood figure out what kind of services they might need. I should also say, for people who are interested in Robin Hood or who like Tina Fey, Robin Hood is having its annual benefit online this year. Usually it would be at the Javits Center, but the Javits Center, as we know, was repurposed as an emergency hospital. So their benefit this year is going to be online Monday night, May 11th at 7 o'clock. It's an hour-long benefit hosted by Tina Fey. Who else is going to be in the benefit, Matt? I know Sting. You can tell what my priorities are.
For some reason, the only one I'm remembering right now is Billy Joel.
Right. So star-studded benefit. And
yeah, there's a lot of people, though. Eli,
I think they're hoping to raise $10 million to support agencies throughout New York City to help families, including legal assistance, as we've been discussing today. But, food assistance, income assistance, advice about benefits.
Yeah, and if you want to find more information on the Poverty Tracker project, you could go, our website is listed down here at the bottom. Am I still sharing my screen?
Yep.
Okay. Yeah, it's listed down here at the bottom. And then also on the Robin Hood website, I'm not exactly sure the exact pages to click, but it should be pretty easy to find. I think it's down at the bottom. But they have like their special initiatives listed, and the Poverty Tracker is one of them. And they list all of the reports we've done so far using the Poverty Tracker data. So there's all these different reports on different topics. In January, every year we kind of put out a state of poverty in New York City report. So you can find that there too, where it just details the state of poverty and hardship in New York City over time and in the most recent year.
And then we do just have another question that came in. If you have a child home from school due to closure, is there a max age limit for the child in order to take this leave?
That's a good question. I didn't come across anything about an age limit, but it totally makes sense as a having a 17-year-old would be quite different than having a 2-year-old. Um, I don't think that there's a max age limit. I don't think they could be over 18 years old. But I would point you to the fact sheets to confirm specifically because I don't know off the top of my head.
Yeah, I don't know either. It's a very good question. For things like childcare reimbursement or childcare subsidies, often it's for kids under the age of 13. Because as Matt was saying, we make different assumptions about, older kids needing care or not needing care. But in this case, where it's kids being home from school, I'm not sure that there was an age cutoff other than just, under age 18. But check the fact sheet.
Yeah, I certainly didn't come across any age listed anywhere, but I don't know that for a fact, so I would double check.
I mean, these laws were passed so hurriedly through Congress. It's great that paid family leave was included and that there are these provisions. I don't think they got into that level of detail.
All right, and then I'm kind of follow up to that last question is good. But again, once again, if a child is out of school and you're able to work remotely, you cannot obtain family leave, correct?
Right.
I was not aware of that, but Matt, you're saying under the federal law, if you're working from home, you can't take family leave if that's interfering with your work. I didn't realize that.
Yeah, I don't know. I think that it does say if you can work from home, you can't use family leave. But
Okay.
I think, but you may be able to say I can't work from home, right? And I'm staying home because my child is home, right? Like you might be able to work from home under normal circumstances, but if your child is home and you can't work from home, you might be able to claim it. I would double check on that too.
But that's under the federal law. So again, it's worth checking the state-specific provisions. So we had that last link is about state laws that have been amended with COVID-specific provisions. So like
Right.
whether New York State's paid family leave law has been amended to cover caring for kids who are home from school. And does that have that telework restriction? I don't know.
Right. Yeah. There's obviously a lot has been passed and there's a lot of specific details with each law. So I don't want to say anything definite about that without knowing.
Yeah.
So I would say double check what the laws say, which you can find on those fact sheets.
Okay. And then this is still going to go back to about working from home, about requesting working from home while we are still under the COVID-19 mitigation, and you're considered high risk if you have a doctor's letter requesting special accommodations with conditions requiring guaranteed safety. Might that be a way? And requesting provisions governed under disability laws.
That makes sense to me, but that's kind of beyond our level of expertise. So I think there actually is going to be a separate webinar about disability and disability provisions. So those provisions are very highly specialized, and under the ADA, there are pretty extensive rights for accommodation. So I think the questioner is right that that's the appropriate mechanism. But because it's beyond our expertise, I don't want to, I don't want to venture an opinion about that.
I've seen a lot of information about the laws, but where does one go to apply for paid leave to care for a child whose school has closed?
So the starting point for an application is to the employer, because this benefit is coming from the employer and the employer pays it. So it's, think of it as just being like personal time or paid vacation time or paid sick time. It's another type of employer benefit. So the benefit comes from the employer. And as I was saying earlier, behind the scenes, the employer may be getting some reimbursement from the federal government or from a state insurance fund, but the employee is working with the employer, and the employer is issuing the payment.
right, and that's all for our questions that we have for right now. I will say that a comment I'm just going to share that I saw in the chat box earlier was saying that from this webinar, I'm realizing that many employers don't know what the law is or
Yeah.
they don't care.
Yeah.
That was a comment that definitely stood out to me there. And there's lots of thank yous for this information. We have about a couple minutes left. Are there any ending words or points that you guys want to convey?
I would just add that on that point about employers not following rules, that any documentation is probably good to have, either from your doctor or from your child's school, whatever, just in case there's any dispute, you can document what you're going through.
Yeah, and I think that it was an astute comment that many employers are not familiar with this. They're not. Many employees are not familiar either. And so, the first step as an employee is to make employers aware of it by sharing some of these fact sheets and some of these resources. Because, hopefully if employers are aware of it, that's a step closer to having employers comply and actually provide the paid leave. So, if they don't know about it, they can't provide it. So I think the first step is making employers aware. So there is a chain here from social workers making sure that their clients and people in their communities are aware of these provisions, so that people can then work with their employers to make sure employers are aware of it and that they're able to get the benefits that they need. So yeah, the responsibility is on all of us to try to get this information out, because as I was saying earlier, if it's not out there, then people may be leaving jobs or taking unpaid leave or reducing their hours unnecessarily when they could be taking at least some paid leave and maintaining their paychecks. So it is really important to get the information out.
Thank you. Thank you guys so much. And I'm going to end on this question here, Jane and Matt. For folks who are who may live in New York or work in a tri-state area or vice versa, where would they go for cross-state information regarding childcare leave?
The end of the slides has the information in detail about all the New York laws. New Jersey is a state that also has paid family leave, and Connecticut is a state that has paid sick leave. So I would refer to these links from the National Partnership on Women and Families. And I know they do a really good job of keeping those resources up to date. So they have one sheet for paid sick leave laws by state. They have another one by city and county, and they have another one for paid family leave laws by state. So I would definitely go there, because it's not just New York that has provisions, but Connecticut for sure is the state that has these provisions, and New Jersey does. And Rhode Island and Massachusetts and California is probably the most active state. So wherever people are in the country, you may have special city, county, or state provisions that you should be familiar with.
All right, thank you guys again so much for your time, and thank you for everybody who's joined in. This was really great questions, a lot of information. The slides will be available. I just posted the link for the COVID-19 Action website. I'm posting it right now again in a chat box, so that way you can go there and you can see, you can go ahead and download the slides from today's presentation, as well as any of the presentations once they've passed for the COVID-19 Action trainings. All right, we wish everybody a great weekend, and thank you everybody for joining us.
Thanks, everyone.
Thanks, everyone.
Bye.